Some people don't fully appreciate our modern medicines or vaccines available to us today. However, many lives have been sacrificed to overcome past diseases. These viruses led to many discoveries and cures for modern-day illnesses. One past pandemic that was a major aid to modern medicine developments was the bubonic plague, also commonly referred to as the Black Death.
The bubonic plague made its first appearance in Central Asia during the year of 1347, when 12 trading ships docked at a port in Messina after a timely and taxing journey. People gathered by the port and were terrified to find most of the sailors deceased with strange black welts leaking fluid on their skin.
The port's authorities quickly demanded the ships leave the harbor. Unfortunately, the plague had already made its mark on Central Asia.
From there, the plague hastily spread throughout the Mediterranean islands and into Europe, beginning in Italy, parts of Spain, and France.
After laying anchors in southern Europe, the Black Death proceeded to infecting highly populated cities in Europe, mainly on trade routes. One of the last countries affected by the plague was England. This is a result of its isolation as an island and because the plague was spread by contaminated fleas which traveled on rats. With a high population of rats during this time period, fleas were commonly associated with humans.
People infected with the plague often experience black lymph nodes called buboes. Buboes are highly contagious and they carry part of the disease in them. The welts can grow to be the size of a tennis ball and can emit large amounts of blood, pus, and other bodily fluids. The buboes are commonly found at the site of the infection, often where the bite occurs. In addition, the buboes appear in the neck, armpits, and groin area. Oftentimes before the welt appears, pain can be present in the infected area. They also possibly experienced chills, fevers, dizziness, headaches, and seizures.
After 2 to 5 days of exposure to the bacteria, the victim would start reacting to the plague and symptoms would begin. Without receiving treatment, the infected had a 50% chance of death.
When the bubonic plague first arose, there was no cure. Now, with the help of modern science technology, there is a treatment for the bubonic plague. One remedy for the Black Death is to avoid it at all costs. Where the plague is commonly found, avoid being bitten by rats or fleas. Houses should be rat-proofed, and pets, such as dogs and cats, should be medicated for fleas. When treating the disease, the patients receive antibiotics through an IV. Patients that have trouble breathing or severe bleeding will be rushed to the intensive care unit, also known as the ICU.
Some of the specific antibiotics that should be taken when infected with the bubonic plague are streptomycin, gentamicin, doxycycline, and ciprofloxacin.
These antibiotics, which resulted from the bubonic plague, were found to help other diseases as well. The antibiotics also treat tuberculosis, infections in the eyes, skin imperfections such as blemishes or bumps, and help fight bacteria. With the help of these medications, 7-year-old Sierra Jane Downing was able to recover from contracting the bubonic plague.
The 7-year-old can wheel around Rocky Mountain Hospital for Children now, but when Sierra Jane Downing arrived from Pagosa Springs 11 days ago, she had a core temperature of 107.
Most of the hospitals were just saying, she'll be fine tomorrow, you just keep her there, keep her on watch.
The seizure and bug bites, combined with a recent encounter with a dead squirrel, brought her to Denver, the first actual case of bubonic plague these doctors had ever seen.
You know, you read about how ill they can be, and it is impressively so how rapidly it happened, honestly.
While she left the intensive care unit on Monday, Sierra is still hurting.
Okay. Yeah, she's getting tired.
The Black Plague and all the hoopla, really a greater infection has occurred, and it's love.
Today, the plague is still a threat to society. With ever-growing population of rats and the result of overflowing landfills, flea populations are also on the rise. therefore increasing the odds of contracting the bubonic plague disease.